Hello dear students, welcome back to the dental class. I hope everyone is doing good in their lives. So today I am going to discuss about buccal nerve block and lingual nerve block. We'll start from the buccal nerve block, which is also called buccinator nerve block and more commonly it is called longbuccalnerveblock. Buccal nerve block is used when buccal soft tissue adjacent to the molars in the mandible needs to be manipulated like in subgingival procedures. The landmarks for the buccal nerve block are mandibular molars and mucobuccal fold in that area. Following all the general steps of any dental local anesthetic injection that we have already discussed in our previous lectures, identify the landmarks of the buccal nerve block like mandibular molars and the mucobuccal fold in that region, and use 25 or 27 gauge long needle. The area of insertion would be distal and buccal to the last mandibular molar. The syringe should be parallel to the occlusal plane and buccal to the mandibular teeth. Penetrate the mucosa for about 2 to 4 mm and deposit few drops of local anesthetic before touching the periosteum to prevent pain on contacting the mucoperiosteum. Then as usual aspirate in two planes. After negative aspiration, deposit 0.3 ml of solution or 1/8 of the cartridge over 10 seconds. Or when the tissue balloons out, then stop depositing. Then withdraw the syringe and make it safe. Wait for 3 to 5 minutes for the anesthesia to get effective. The anatomy of the buccal nerve is a branch of mandibular division of trigeminal nerve and it passes over the anterior border of the ramus, which is the main target area of local anesthetic injection for the buccal nerve block. Buccal nerve provides sensory innervation to the buccal soft tissue adjacent to the mandibular molars. The nerves that is anesthetized with buccal nerve block is only the buccal nerve, and the areas that are anesthetized are buccal soft tissue and periosteum buccal to the mandibular molar teeth. The buccal nerve block rarely fails, but it only fails in cases if inadequate solution of local anesthetic is injected. The complications associated with the buccal nerve block are very rare, but to mention, hematoma can occur. Now let's start with the lingual nerve block. Lingual nerve block is used when lingual soft tissue needs to be manipulated during any procedure. During inferior alveolar nerve block, after depositing the bulk of local anesthetic for inferior alveolar nerve, withdrawing the needle for about half of the total insertion length, which is 20 to 25 mm, and aspirating again and deposit a drop of local anesthetic, this will block the lingual nerve. There is another type of lingual nerve block which is called partial lingual nerve block that is used in conjunction with the incisive nerve block. In this technique, using 25 gauge long needle and depositing about half ml of local anesthetic under the lingual mucosa just distal to the last tooth to be treated. The anatomy of the lingual nerve is, it is located in close approximation with the lingual plate of mandibular molars. Lingual nerve is located in soft tissues medial to the ramus. As it divides from the mandibular nerve, it travels on the lingual side downwards and is located within 3 mm distance from the lingual plate and 2 to 8 mm from the alveolar ridge in the molar region. And as it travels forward, it obtains a more downward position. Lingual nerve provides sensory innervation to the lingual soft tissues and periosteum. The failure and complications associated with the lingual nerve block are very rare except with partial lingual nerve block when lingual nerve is contacted with the needle and it induces electric shock like pain and subsequent paresthesia. That's all with the today's class, which was about buccal and the lingual nerve block. We have learned about the buccal nerve block, the lingual nerve block and partial lingual nerve block. I hope everyone has got to the concept. Please like and subscribe to the dental class, and with that we will end our class. Thank you, goodbye and take care.